This conference will now be recorded.
All right. So hi everyone, my name is Dr. Bhavna Sharma. I work as a medical registrar in the NHS and I specialize in endocrinology. Um, Today I'm going to be doing a small-ish session on OET writing. We're going to be looking at the medical aspects of OET writing. So I'll be going through two important things which people often make a lot of mistakes on the OET writing because they don't really understand the concepts behind them. So we're going to be dealing with the types of letters which can appear on your OET exam. And we'll be going through some tips and tricks. I'll be giving you certain layouts which you can use on various types of letters that appear on the OET writing. I'll also be going through the various types of healthcare workers, so the various types of people that you might be asked to write these letters to, so that we get an idea of what we're supposed to include in the letters that we're writing to these people. So there'll be this session will be divided into two parts. We'll have a small break in between so we can have questions at that time. But make sure that you make lots of notes during this session because that's just going to help you plan your letters for your future. So moving on, just make sure that your mics are off, guys, please. All right, so the first part is the types of letter which might appear on your OET writing. Why do we need to know what kind of letter we're writing? The basic concept behind this is audience awareness. So audience awareness is something that we have discussed in our previous session, but just so that we revise it again. Audience awareness means knowing who your target audience is. For example, if you're giving a musical performance, you want your performance to suit the needs of your audience. You can't sing a Hindi song for people who are an English speaking population, or you can't sing very old songs for a young population. So you need to know what your target audience is, and then you need to perform your task depending upon what your target audience needs. So before you start writing any letter, you need to ask yourself, you need to read your task and you need to ask yourself who your audience is, what is their role in the care of your patient, and what information would they need to perform their role nicely. So these three questions need to be answered through your OET letter. Okay, so the first type of letter which can appear on your OET writing is your referral letter. For nurses, it might be a letter that you write to a community nurse, a physiotherapist, a GP, or an occupational therapist. For doctors, you can have various specialities, but we have also seen letters that we write to dietitians and occupational therapists and GPs. So you need to be prepared for all of these types of letters, but remember the OET is known for giving you surprises. So the type of letter might change, or you may find a new audience when you're writing your letter. So just be prepared. So what is expected in a referral letter is that you were taking care of this patient for a certain period of time. Um, Probably you were the regular carer of this patient, and now this patient is being referred to another specialist for a particular reason. Okay, so when you read your task, you need to understand what this specialist needs to know with regards to their role and what needs to be included from your case notes for this specialist to know so that they can do the job that you want them to do. So this is a very important slide, guys. Just make sure that we note down everything on this slide, or you can take a screenshot if you want. I've given you a referral letter template. So this is how you're basically going to write your referral letter. So everyone knows what the basic format of a letter is. If you're still confused about it, this was discussed in our previous lecture. So you can go back to it and look at the basic format of the letter, how you write the date, how you write the address, and how you introduce your patient. When you're just writing a specific referral letter, you start out with your first paragraph, which will be your introduction. Now, in this, you need to summarize one, the patient's chief complaint, and second, what you want your audience to do. So, a very good way of starting this is, I am writing this letter to refer, and where the dash is, you just put in your patient's name. Make sure that the salutation that you're using for this patient, make sure that the title that you're using for this patient is same as what your case notes say. So I'm writing this letter to refer Mrs. Jones, who has complaints of dash. So you can just enter what they came to you with. So it can be who has complaints of abdominal pain, who has complaints of feeling generally unwell, who has complaints of persistent headache. So you can cut, copy, paste this. So I'm writing this letter to refer dash who has complaints of dash. Full stop. And then you write, your specialist opinion would be highly appreciated. So guys, you can just copy this and you can use this in each and every referral letter that you're writing. Then you go on to your second paragraph. You write about further information of the chief complaint or recent medical history relevant to your first paragraph. So basically, if you had someone who was coming in with abdominal pain, you can start by writing as to how they came to your clinic. So Mrs. Jones presented to our clinic on the, and then you can write the date with history of 2 days of abdominal pain. So this is a very good method of starting the second paragraph of your referral letter. So dash presented to our clinic or presented to our hospital on the, and then you write the date with history of whatever their history was that they came to you with. Then you go on to your third paragraph. This will be your secondary medical information. So basically in this section, you will be covering the past medical history, which might be pertinent to this referral. For example, if this is the letter that you're writing to a surgeon for assessment of possible appendicitis for abdominal pain and they had appendicitis, then you write that Mrs. Jones has a background of previous surgery done for gallstone disease. She had a cholecystectomy done on this and this. So this will be your secondary medical information that you will be offering to the specialist. Remember guys, the secondary medical information has to be what a specialist needs. Okay, so for example, if you have a gynecologist, you're going to give them past medical history about this patient's gynecological history. For example, if this patient has come in with complaints of vomiting during pregnancy, then you write that she has a past medical history of 3 cesareans which were done due to a reduced fetal heart sound. So this will be basically information which a gynecologist would need. Similarly, for nurses, if you are writing this letter to refer a patient to a tissue viability nurse for a diabetic foot, you're going to write, I am writing this letter to refer Miss Jones, who has, so you can change the complaints of to who has a history of diabetic foot or who has findings of diabetic foot. Then your specialist opinion would be appreciated. And then in the secondary medical information part, you're going to include history of diabetes for this patient. If you include history of, for example, a gallstone surgery or a chest infection that the patient had in the past, that's not going to be important to a tissue viability nurse, because the tissue viability nurse is only going to deal with managing the patient's wound. She is not concerned about any chest infections or any other things which aren't specific to the diabetic foot disease that you're talking about. So make sure that the secondary medical information matches your chief complaint. So next paragraph, you start out with your discharge plan or your treatments. Now, what you're going to do at this point, you're going to talk about the treatments that you might have given this patient before. So, if, for example, nurses, if you're writing to a tissue viability nurse, you can talk about that this patient has been undergoing treatment for her diabetic foot in our practice. Unfortunately, this is a very good method of writing that why you need this referral. You can actually put in a comma after the unfortunately. So unfortunately, comma, his or her symptoms still persist. So this is a very good method of starting your fourth paragraph in a referral letter. Now I've given you a concluding sentence. So basically in your last paragraph, you're going to tell the person that you're referring to about the provisional diagnosis, or you might just reiterate what you want them to do. So it would be that we opine that Miss Jones might have a provisional diagnosis of appendicitis, full stop. Your specialist opinion would therefore be highly appreciated. Please do not hesitate to contact me in case of any queries. So everyone, you can actually copy this slide and it will help. You can take a picture of this slide, take screenshots if you're on your phone, and you can cut, copy, paste all of these sentences. This is basically a cheat sheet which I've given you for each and every referral letter that you write from now on. So just take a screenshot of this. Now I'm going to do a very small exercise, and I'll split doctors and nurses. For doctors, I want you to give me an introduction. So I want you to give me all the three, A, B, D, and E. I want you to cut, copy, paste the history that I'm giving you into the sentences that I've given you for A, for B, for D, and for E. So I want you to give me an introduction and copy that sentence. I want you to give me further information and copy that sentence, and then the discharge plan and the concluding sentence. Your case is, you have a patient who's come to you with recurrent headaches. You suspect that this patient might have migraines, and you're referring this patient to a neurologist. Okay. So this is your information, and I want you to give me an introduction, further information, discharge plan, and concluding sentences. For nurses, you are referring Mr. Johnson, who's come to you with complaints of, let's make it complaints of, what should we do it? Complaints of chest pain on exertion, and you're referring this patient for an occupational history, you're referring this patient to an occupational therapist. So that's your task. I'm going to write the same on the chat window. Marie has asked, don't we lose grades for using prefabricated sentences? So Marie, these sentences are completely different from what appear on your official OET site. So these are new sentences. So I don't, besides the 90 people who've joined us today, these are actually very, very unique sentences. So they're not the exact cut copy paste sentences which appear on the official website. That's why I'm giving you new sentences that you can use, but feel free to change everything that you anything that you feel more comfortable with. So for doctors, you've got a patient with headaches. You suspect that they might have a subarachnoid hemorrhage and you're referring them to a neurologist. For nurses, you have a patient that you're referring to cardiac, who has come in with anginal pains. And you suspect them to have low exercise tolerance. And you're referring them to a cardiac rehab nurse. Okay, we've started getting answers, so people just keep typing in your answers. We're going to give everyone 2 minutes. These sentences are actually unique that we've made ourselves for the purpose of this lecture, so that people who cut, copy, paste things from the official OET site, they've got a little bit of variety. All right, I've started getting some answers. I'm going to read out the answers that we've got. We're going to correct people who've made a little bit of grammatical mistakes. But guys, please don't feel shy. If you make mistakes here, it's fine, because obviously if you make mistakes here and they're corrected, now you're not going to make the same mistakes on your test. So Dr. Manjunath has written, used A, and he's written, I am writing this letter to refer Mrs. Jones, who has complaints of recurrent headache. So Dr. Manjunath, it's if you have something which is recurrent, it's going to be in plural. So it would be, I'm writing this letter to refer Mrs. Jones, who has complaints of recurrent headaches. So the headaches will be a S. Your specialist opinion would be highly appreciated. Excellent. Rush has written, I'm writing to refer Mrs. Jones, who has features consistent with subarachnoid hemorrhage. Your specialty opinion would be highly appreciated. So Rush, you need to change this. This sentence is actually incorrect. It should be your specialist opinion would be highly appreciated. So you need to change specialty to specialist, and would be highly appreciated. So just copy this sentence and just fit in the things. If you struggle with grammar, if you're very comfortable with your English, then you don't need to copy these sentences, but this is just for people who make loads of mistakes on their grammar. Aruna has written, I'm writing this letter to refer Mrs. Jones, who has history of headache with suspected subarachnoid hemorrhage. Your specialist opinion would be highly appreciated. So Aruna, that's right. But when you write Mrs. Jones, the J should be capital. So the first name of the patient and the second name of the patient should begin with a capital letter. Nimish has said, Thank you for seeing Mr. John, comma, suffering from continuous headache. I am writing this letter to refer Mr. John for your further opinion and management. Your expert opinion would be highly appreciated. So Nimish, that's right. So lots of good answers. Krishna has said, I'm writing this letter to refer Mrs. Jones, whose clinical features are suggestive of subarachnoid hemorrhage, full stop. Your specialist opinion would be highly appreciated. So Krishna, you need to put, once you put a full stop and you start with your, the Y has to be a capital. Okay. Guys, what you can do is, that's something that I do advise people to do, is in your introduction talk about the chief complaint and you give that line about your specialist opinion would be greatly appreciated. It's very good that when you're writing to a specialist, you don't give them a diagnosis. Okay. What a specialist means is someone who knows a little bit more about the medical condition than you, and that's why you're making a specialist referral. Okay, so you cannot tell a surgeon that the patient definitely has appendicitis. That would be your provisional diagnosis. The surgeon will decide that they've got appendicitis. Again, you cannot tell a gynecologist that a patient has an ectopic pregnancy. It's the gynecologist who decides it. So make sure that you do not tell the person that you're writing to your diagnosis as final. That's why I've given you the concluding sentence about we feel. It can either be we opine that, or you can change it to we feel that Miss Jones might have a provisional diagnosis of dash. You should not write that we feel that Mrs. Jones has a subarachnoid hemorrhage. So might have a provisional diagnosis sounds much nicer to a specialist. Okay. So just remember that a specialist means that they know the best about that medical condition compared to other people. So inserting provisional diagnosis in the last paragraph is going to help you out a lot. All right. Okay, so just covering the nurses, Divya has written, I am writing this letter to refer Mr. Johnson, who has complaints of chest pain on exertion. Divya, the spelling of exertion was wrong, but it's okay. If you revise your letter and you look at the case notes, they would probably have given you the spelling for exertion. So you can copy that spelling from there. But if you're making such mistakes about medical terms, Divya, just make sure that you go back to your case notes at the end and revise the spellings that they've given you. All right, excellent. So lots of good answers. Pratibha, Nishant, Sabha, very good answers. So I'm very happy. We'll move on to the next type of letter now. So the next type of letter is a discharge letter. For nurses, the discharge might be to a retirement home or a GP. Both of them have appeared on the OET. For doctors, usually the discharge is to a GP. So basically, a discharge letter might be that you are a nurse or a doctor working in a hospital, and now the patient is going back to their regular carer, which is their GP. If it's an elderly gentleman who's been admitted to the hospital, the discharge letter might be to their nursing home, to their retirement home. So that has appeared on the OET and it might appear on your test as well. So make sure that you're prepared. What the thing that I try to compare a discharge letter to is a referral letter is like, for example, you have a car, okay, and that car has broken down and you take the car to a mechanic and tell them about how your car broke down. So you're only going to give them a history of the car breaking down and what you want them to do. Now, a discharge letter is when you're selling the car. So this car is now going to become the car of another person. So you're going to tell them each and everything that they need to know about this car. They need to know when the car was, when you bought this car originally, what history have you had with the car? Has the car had any accidents? And what care does the car need now? So discharge letter is like passing the ball along. So the content of a discharge letter will be much more compared to a referral letter. That being said, mostly discharges are done back to the regular carer for the patient. So it is very, very possible that the retirement home, the nursing home, or the GP that you're discharging this patient back to knows better than you. So if you were the person taking care of this patient only while they were in the hospital, you're an expert only about the hospital visit. The rest of the things the GP might know better than you. So we need to keep that concept in mind. Okay, now again, I've given you a discharge letter template here. Guys, again, screenshots, make notes. I'll give you a few options so that you don't feel like everyone is going to write the same thing. So in your discharge letter, the first thing that you write is your introduction. The main things that you do need to include in the introduction is when is this patient being discharged, the patient's chief complaint that they came to you with, and the recovery status. Okay, a good way that I like to begin this letter is I am writing this letter to inform you regarding this patient. So this will be your patient's name, Mrs. Jones, an apostrophe S, impending discharge. So Mr. Wilson's, then apostrophe S, impending discharge. Full stop, dash, which will be your patient's name. Mr. Wilson is being discharged today or is being discharged this week. So you have to just mention the date that they're being discharged back into your care after being diagnosed or being admitted to a hospital with complaints of dash. So basically here, you're going to be writing about the reason why they came to you in a hospital with, okay? And then full stop, fortunately, comma, dash has recovered well, okay? An alternative that you can use is fortunately, Mr. Johnson has done well during this admission. That's another way that you can write this letter. There can be an alternative. Ikra, if you're not able to hear me, you need to make sure that you're not using a mic and the sound turned on is on your computer noise. Okay, just make sure that you change that. There can be a case which can be quite difficult is when you're discharging people back to their nursing home and they're actually quite unwell. So you can then change that statement. Do not write fortunately then. You would have to write unfortunately during this admission, Mr. Jones' recovery has been limited. Okay, so just pay attention to the tenses which have been used. Again, if you struggle with your grammar, you can copy these lines. Okay, these are lines which are different from what you get in your official OET, so it's not going to be the same for everyone. Then in the next paragraph, you're going to write about further information about the chief complaint or the recovery status. So you're going to write Mr. John was admitted to the hospital on this date. with complaints of whatever the complaints were. He was treated with this, and he has responded well to given line of management. Um, Guys, a very good method of writing that the patient has recovered is that Mr. Johnson has responded well to the given line of management. Manpreet has asked, can we write unfortunately? Manpreet, if your patient is dying, then you can write unfortunately. But if the patient has got things like diabetes or things which are common medical complaints, then please do not write unfortunately. The official OET website has forbidden using unfortunately. For unfortunately, Mr. Johnson suffers from hypertension. So that's not really an unfortunate thing because it's a treatable medical condition. But if your patient is going to die of their cancer, then you can use unfortunately. Okay. Then your third paragraph will be their secondary complaint status. So if they've come in with for example, abdominal pain, and they also had a new diagnosis of atrial fibrillation. So that will be in your third paragraph. So that would be the secondary complaints. For nurses, if they're being discharged after being admitted to the hospital with diabetic ketoacidosis, and their secondary complaints are hypertension, which you've treated, that would be your secondary complaint status. So if they were admitted with the hospital with diabetic ketoacidosis, but you also found them to have hypertension, so the diabetes will be your chief complaint, or the diabetic ketoacidosis will be your chief complaint, and your secondary complaint would be your hypertension. This is applicable to both nurses and doctors. Okay. Then will be your discharge plan, treatment plan, and medications. This needs to come into your, Shushma has been asking, is this for nurses and doctors? Shushma, this is applicable to both nurses and doctors. Then on your discharge plan, on your fourth paragraph, you're going to be writing about the discharge plan. This is very, very important, guys, because when you admit a patient and you treat them, that's done. But this patient does need to get followed up. They do need to continue certain things to remain healthy. If you've treated them and then they go home and they don't take their medications, or you don't tell the nursing home that they're supposed to have these medications, or you don't tell the nursing home that they're supposed to have their wound dressed, then that's going to make your patient ill again. So it's going to completely undermine the treatment that you've given this patient. So the discharge plan, if you miss it on your OET writing, you will fail, okay? Because the whole purpose of writing a discharge letter is to make a regular carer aware of what you've done to them in the hospital and what they need to do in order to make sure that your patient remains healthy. So in your discharge plan, a very good method that we suggest that you use is dash is being discharged with advice to, and then in the advice to section is to continue medications, advice to have regular dressings, advice to participate in regular exercise. So it's a very good method. So make sure that you note down that the tense that you use is that Mr. Jones is being discharged, and then you write with advice to. Okay, so that's the full sentence which you can copy. Okay, you can also write he or she would need to continue the following medications dash as started by the hospital in the community. For example, if your patient came to you with diabetic ketoacidosis and they were started on insulin, then you write that she would need to continue the insulin as started by the hospital in community. Okay, So you can cut, copy, paste these lines. These are completely correct grammatical sentences which you just need to insert the patient's name or the medications into. So if you struggle with your grammar, take a screenshot of this slide and use it on your test. That will make your life much easier for people, especially with weak English. If you feel like you've got the best English and you want to make your own fancy sentences, I'm more than happy if you do that. But even then, just is make sure that your information is organized. So the template that I've given is the template that I've given should be followed in terms of organizing your paragraph. So they have to be organized into an introduction, further information, secondary complaint, discharge plan, and then your concluding sentence. A very good method of writing your a concluding sentence when you're discharging a patient is: your continued care for the management of this pleasant gentleman or lady would be highly appreciated. And then the thing, please do not hesitate to contact me in case of any queries / questions. So you can either write queries or you can write questions. Okay. So make sure you do that. Continued care is quite good because when you discharge a patient, you need to maintain something called continuity of care. So the patient doesn't miss out on having a healthcare worker looking after them. So that's why it's your continued care. There are marks for having a polite language on your OET writing. So if you copy this sentence, you should be able to score marks on your OET writing. Nishant has asked, what about lab reports in discharge summary? Do we need to add them? Nishant, if you've got extremely abnormal lab results, for example, if you had the diabetic ketoacidosis patient and they came in with a blood sugar of about 40 millimoles, then you include it. But if they've got normal lab reports, then you're just going to waste space by writing about lab reports. You can mention that they have had a normal full blood count if you really want to mention it. Perhaps that would be important if the patient came to and was diagnosed with a viral pneumonia. Then you can write the patient had a normal full blood count. You can put that in your second paragraph. So that would be your further information of chief complaint or recovery medication. Marie has asked, do we need to be extremely selective about what we include in our essays? Mary, the thing is that on the OET writing, if you look through the official OET scoring criteria, you've got marks for content and clarity. So clarity on the OET writing means that you don't include information which is not important to the person that you're writing to. And this does happen quite a lot. For example, a few months earlier, we had the OET writing where loads of students failed, is when they had a letter that they had to write to a surgeon, and they made it really confusing by including multiple visits, and they mentioned things like upper respiratory tract infection or the psychological problems that the patient had. And everyone, lots of students, they got confused with these multiple visits and they weren't able to select what was important to a surgeon, which was the history of previous operations, previous allergies to some anesthetic agents, and then they included psychological history and history of infections which weren't really important, and that's why they failed on the OET. It's not just about the word count, it is also about including information which isn't important. All right. Moving on to the next type of letter, this will be your transfer letter. So a transfer letter basically is a letter where you, for example, you were taking care of this patient. Now this patient is being moved to another. So you are not this patient's regular carer. Okay, for example, this patient was in your hospital, now they're moving to another hospital, or this patient was in a hospital and now they're being referred to the community nurse. Okay, I'm going to explain what a community nurse means and all of the terms that I've used for healthcare workers in the second part of this lecture. So don't get too confused. A transfer letter basically means that it's different from discharge letter, because discharge letter is more to the regular carers, while transfer letter is to another a set of carers who might not be this patient's regular caretakers. For example, in doctors, you can have patients being transferred to a specialist hospital like a psychiatry hospital or a children's hospital. Um, so in that case, this you would need to introduce this patient as a new patient to that. So discharge letter was different in the case that the person already knew everything about that patient's past medical history. But in a transfer letter, this the person that you're writing the letter to knows nothing about that patient. So this is a new patient for them, and that's why you need to include all the history that you think is important for the care of this patient. Again, I've given you a template for the transfer letter. So you again divide it into 5 parts. In your introduction, you summarized when is the patient going to be when is the patient will be transferred, where is the patient being transferred to, and the patient's chief complaint. So very good method of writing this is, I am writing this letter to inform you regarding this patient's imminent transfer into your esteemed care. So look at my language. My language is very, very polite, and you have marks for politeness on your OET writing. Dash is being transferred today to whatever the hospital, to your nursing home, to your hospital, to your psychiatric unit, due to his or her ongoing medical/social need. So if they're being transferred to another hospital, then that would be due to her or his or her ongoing medical needs. If they're being transferred into a residential home or a care home, then that would be due to their ongoing medical as well as social needs. So make sure that you plan that sentence around. Okay. Then you write about further information of chief complaint. So if for nurses, if you have a patient that was admitted to a hospital and you felt that they want, so this patient, let's try to give a background to this patient. So if you've got a patient who, this is a very common example that we do get in our hospitals quite a lot, especially in geriatrics, that you get a patient who's come to you with recurrent falls, and then the physio team saw this patient in the hospital and they feel like he won't be able to manage at home again. Then you transfer this patient to a care home or to a nursing home. So because this patient earlier stayed at home and now he's going to a care home, so this is going to be a transfer letter. Okay. If this was a patient that came to you with recurrent falls, the physio team or the occupational team felt like they couldn't manage and this patient was going back to their home, then that would be a discharge letter. So nurses, please let me know if you've understood that concept as to how in the first example it was a transfer letter because they were going back to a new nursing home. So that's why it was a transfer letter. And in the second case, because they were going back to their own home, with a little bit of a community physio, that was a discharge letter. So please type in yes if you've understood that concept. Doctors, if you've understood that concept as to why this was a transfer letter and the other one was a discharge letter, please type in yes. Okay, excellent. Hema hasn't understood, so I'm going to explain again. Is you have a patient who's come from their home. He's come to the hospital with lots of falls. Okay, the occupational team saw this patient and they felt they won't be able to manage at their own home. So they've arranged a new nursing home for this patient to go to. Now this patient is not going back home, so he's not going back to his regular care. He's going back to a new set of people in a new nursing home. So that's why this patient, his care is being transferred from a hospital to a nursing home, and that's why it's a transfer letter. If this patient had come to you with falls and the occupational therapy team thought that maybe he can still manage at his own home, but he does need a little bit of the GP to help out with care at home, and then you write a letter to that GP that I am discharging this patient back to his home, but you as a GP need to still take care of him because he's got a number of ongoing medical and social needs. That would be a discharge letter, because they're getting discharged back to people they already know. Okay, if you've understood that concept, please type in yes. So Nima, Songor, Hema, Fasiha, Mariam, SD, if you've understood that concept, please type in yes. Excellent. Now that everyone has understood the concept of what a transfer letter means and what a discharge letter means, now you would be able to select what information is needed on a transfer letter and what information is needed on a discharge letter. So on a transfer letter, you will introduce this patient to them as a new patient. Okay, and in a discharge letter you will be perhaps telling them again about the things that the patient already has. Okay, so that's how a transfer letter is different from a discharge letter. Now in the first section, that please make sure that your mic is off. Okay, so in the third section of a transfer letter, you would need to mention this patient's medical history. For example, you would write that this patient has a history. So if this patient is being the patient with the falls was going to a nursing home, you would need to tell them that this patient also has a history of diabetes, of poorly controlled diabetes and poorly controlled hypertension, so that the nursing home then knows that okay, this patient isn't controlling his diabetes or blood pressure medication well, so therefore the nursing home needs to ensure that this patient gets his medications on time. And that's why it's important to mention all the medical history that the patient has on a transfer letter. If as a doctor or a nurse you forget to mention that this patient has diabetes, then the nursing home might not give the medications for diabetes and your patient might get very ill. Okay, so that's why it's very important to mention the important medical needs the patient has on a transfer letter. You don't need to mention each and everything. Okay, you do need to mention the bullet points. Okay, you don't need to tell them okay, he had a blood sugar of 4 in the morning and 8 in the evening. That's not important, but you do need to mention that he has uncontrolled diabetes or he has well controlled diabetes. So you just need to summarize that information just to make sure that it gets followed up. All right. Now, very good method of writing about a transfer plan or a treatment plan is on the fourth paragraph. You need to mention is that Mr. Jones would need ongoing care for his or her diabetes. He would need regular whatever they need. For example, if they've got a diabetic foot and they need dressing for it, then you need to mention it on your transfer plan. So he would need regular dressing of his diabetic foot. And if he's come with falls, is that he would need regular monitoring of his blood sugars, and he would need a regular assistance with his activities of daily living. So guys, please make sure on your OET task, you will have a transfer plan, and it would need to be mentioned very nicely on your fourth paragraph. So in a transfer letter, the most important thing is the transfer plan, okay? If you don't mention that well, you're going to score very poorly on your content, and you might fail if you miss out mentioning the medications the patient has, the treatments the patient is on, and what you want the nursing home to do, or what you want the psychiatric hospital to do, or what you want the children's hospital to do. So similar to the discharge letter, you can write is that your continued care with regards to this pleasant lady or gentleman would be highly appreciated. Please do not hesitate to contact me in case of any queries or questions. All right, so Hema has asked what is the word limit on OET writing? The suggested writing, the word suggested on the official OET site is 180 to 200. But remember, even if you feel like you're going above 200, it still has to only include relevant information, okay? If you're going above 200 and including only relevant, then it's fine. But if you're including information which is not important, you're going to lose marks. So the important thing is that you include things which are important depending upon the type of letter that you have and the person that you're writing to. And the unimportant things are the information that they don't need to take care of your patient. So make sure that we understand that the purpose of OET writing is to make sure that if you are given a job, are you able to carry out that job well? So if you are given a job to take care of a patient or tell someone else to take care of your patient, the purpose of OET writing is to find out is if you are a safe doctor or a safe nurse who will be able to convey that message across in a written form to make sure that you're able to take care of your patients when you come and work in a foreign country. Kajal has asked how to summarize multiple visits. Kajal, I have taken a lecture about that last week. So you can go to our YouTube channel and find out about how to summarize multiple visits. Our YouTube channel is Teacher Academy. Practice tests for discharge and transfer letters. You can find some practice tests on our website, Hema. And obviously on the official OET website, they do give you discharge and transfer letters. So you can find some practice tests there. All right, moving on. Now, the task in OET writing. You can have different tasks on your OET writing section. For nurses, the common guys, please take a screenshot of this as well. These are the common tasks that you get on your OET writing. In nurses, very common things that you get are wound care, medication compliance, administration of medication, parenting support, and social needs. Okay, you can write on your letter with regards to your main task is that Miss Dash would need your esteemed / valued help with regards to his or her, and then you can write whatever your task is. So that would be so Mr. Jones would need your esteemed / valued help with regards to his wound care. or Mrs. Johnson would need your valued help with regards to her medication compliance. Okay, so you can cut, copy, paste your task on your OET writing in that sentence. For people on doctors, the common tasks that you get are advice on surgery, follow-up care, medication compliance, tests, diagnosis, management of medical condition, and second opinion. Okay, depending upon what your task is, you're supposed to tailor your letter to your task. Okay, so when you read your letter, you go straight to your task and then you look at what they want you to do. They'll ask you that you need refer this patient to us back to their GP, making sure they comply to their medication. So then you would write, Mr. Jones would need your valued care or esteemed help in terms of his or her medication compliance. Okay, so you can just copy those sentences and use them on your OET writing. All right, so before we begin our next section, I just wanted to let you guys know about the teacher writing and speaking check that we have. It's the only writing check that has the unique 5-step writing check. So what we do is when you enroll with us for a writing check or a speaking check, we ask you a questionnaire asking about your previous experiences on the OET writing, on the OET speaking. We ask you about your previous scores and your main concerns. Are your concerns grammar? Are your concerns content? Are your concerns clarity? And then we send you a customized task depending upon your previous scores and your main concerns. When you send us your letter back, it's actually checked by 2 people. So depending upon whether you're a doctor or a nurse, your first check will be done by a person of the same professions. So for doctors, we'll get it checked by doctors, and for nurses, we'll get it checked by nurses. So that's actually, we find that quite helpful, because only doctors or nurses can give you opinion about content and clarity, because only they understand medical language. That's very different from other academies which are only run by English teachers. Teacher Academy is run by both doctors and nurses. That's why we give you a lecture by a doctor on Saturday and a lecture by an English teacher on Sunday, because we understand that OET is both medical as well as English. So it's medical English. That's why we try and cover both aspects. To make sure that your grammar is good, we then get it checked by an English teacher to make sure your grammatical mistakes are looked at. And the final score that you get are based on the OET scoring criteria. So you get a very good detailed feedback, which gives you a study plan as well that you can use, and you can possibly try and improve each and every time you write a letter or get a speaking check done with us. The cost of it is £6.99 per letter. So we do 1 letter check at a time. So that would start from £6.99, but you can go to our website and check it out. Just if you're interested and you want to make sure that you pass your OET writing or your speaking, it should be quite helpful. So guys, please check out our website. All right. Moving on. Now I'm going to talk about the types of audience that you get on your OET writing. I often find people get very, very confused with who exactly you're writing a letter to, because the healthcare roles on the OET writing are similar to a Western healthcare setup. So you might be unfamiliar, especially if you're practicing in another country. You might not be familiar with what a GP is or what a district nurse is and what exactly they're doing. So you're not able to write a correct letter. You don't really know what information that you're supposed to include. So I'll just go through the healthcare people that can appear on your OET writing. So the first person who appears most commonly on your OET writing is your GP. A GP is the regular doctor for a patient. Okay, So in the UK or in Australia or in any Western country, we've got people called general practitioners. These are basically people who are regularly review patients from the day that they're born to the day that they die. Every person in the UK has a doctor attached to them, who will be taking care of all their healthcare needs, making referrals to specialists, getting letters back from specialists. If this patient gets admitted in a hospital, then once the hospital discharges this patient, they let the GP know, okay, your patient came to us with appendicitis, he's had an appendicectomy, we've changed his medications. The GP has a record of all your medical problems. They have a record of all your medications. If a hospital makes any changes to a patient's medications, they're supposed to let the GP know, because the GP is the person who's going to be prescribing medications for you. Okay. So when you're writing a letter to a GP, they're going to have idea about all of the past medical history that the patient had, but they won't know about what happened to them when this patient went from their care to a hospital. So when you write a letter to the GP, the more important things are the new changes which happened. So if a patient was admitted to you with diabetic ketoacidosis and you changed their metformin to insulin, you need to let them know is that so you can write down, guys, please note this line down, during the course of hospital stay. So that's a very good method of writing about a patient's hospital admission. So the sentence is, during the course of hospital stay, comma, Mr. Johnson's metformin has been stopped and switched to insulin. Okay. So that's the way that you inform the GP about medication changes. I'll repeat that again. During the course of hospital stay, I'll type that down as well for people. During the course of hospital stay, Mr. John's metformin has been switched to insulin. So that is the way that you can write about medications being changed. So very good method. You can also change that to during the course of this admission, Mr. John's metformin has been switched to insulin. Or you can write, during the course of hospital stay, comma, Mr. John has been started on insulin. Okay. So if you're talking about new medications, you write Mr. John has been started on, or you write Mr. John's metformin has been switched to. Make sure you remember that you write has been. Okay. All right. Lots of people ask me that do we need to mention past medical history to a GP? You don't need to mention past medical history which wasn't relevant to this admission. But if you've got a patient who was admitted to you with diabetic ketoacidosis, obviously you want to mention to the GP that this patient was already being diagnosed with diabetic ketoacidosis, with diabetes. It's just that the diabetes has gotten a little worse now. Then you can use the sentence that I've given you here, which is, as you may already know, Mr. Jones has been diagnosed with diabetes in the past, or has been diagnosed with diabetes since the past 5 years. Okay. Now let's do a small exercise. You've got a patient who has been admitted to the hospital with malignant hypertension. I want you to write a sentence which tells the GP that this patient had hypertension for 5 years. So just copy the last line about this patient having hypertension for 5 years. How would you write that to a letter to the GP? Nurses, I want you to answer as well. So copy the last line and tell the GP about this patient's past medical history of hypertension. Guys, please type in the chat. Okay, so Marie, I'm happy with your sentence. She has written that, as you may already know, comma, Mr. Jones has had hypertension for 5 years. So that's correct. Anita and Sonia, you have written Mr. Smith has been suffering from hypertension for 5 years. The GP already knows this. You need to make sure that you tell them that you know that they know. Okay, you are reiterating a thing that the GP already knows. That's why you write as you may already know. Okay, rather than writing as you already know, Hema, as you may is more polite. As you already know is a sort of a rude way of talking about it. So you write as you may already know. You can put in a comma like Marie did. Dr. Khan, you've also written Mr. Jones is a known hypertensive patient. Remember, the doctor or the GP already knows that. That's why you have to write as you may already know. Excellent. So we've got that concept about what a GP is and what their healthcare role is. And we have drilled it into our minds that the GP already knows everything about the patient. You as a hospital doctor just need to tell them about what happened during this hospital admissions, what changes were made into their care, and what discharge plan you made for this patient. Okay, excellent. Moving on. SD has asked, we have to write this sentence in a discharge letter. SD, usually discharges are done to GP. So yes, you can write this sentence in a discharge letter. Okay, community nurse or a district nurse. Okay, so I came to work in the UK in 2015. I didn't know what a community nurse was. Okay, so community nurse or a district nurse is basically someone who goes from door to door taking care of patients. Their responsibilities can be a lot. They can either be administering insulin. They might sometimes give IV antibiotics if it's antibiotics at home. That does happen. It's a service that we have in the UK. They might be doing dressing, wound dressing for a patient who've got chronic wounds, or they might be trained in tissue viability. So they might be able to take care of diabetic foot in the community. So they're basically nurses. The community or district nurses are basically nurses who aren't attached to a hospital, but they go from one patient's home to another, doing nursing care for a patient. Okay, so sometimes, especially with diabetic people, especially people who've got dementia or people who are quite old or people who don't like injecting insulin to themselves, they might have district nurses who give them insulin at home. So these are the people who might already know the patient. Okay, they might be similar to a GP, but they don't really have a clinic. They're going from home to home. So sometimes it might also happen that the patient might come to you in a hospital, and then you make a plan for them to be seen by the community nurse to make sure that a new medication is done. Okay, so that's why in these kind of letters you would need to make sure that they know about the treatment plan for the patient. You need to make sure that they know what they're supposed to do. So you will write about we would highly appreciate if this patient could have your care with regards to wound management. Okay, so you need to tell them what exactly you want them to do. We would highly appreciate if this patient could have your care with regards to ensuring that he gets his insulin. Okay, so a good way of writing a letter to a community or a district nurses is we would highly appreciate if Mr. Jones could be followed up in the community with regards to in regards to his or her ongoing medical needs. In place of medical needs, you can write in regards to her wound management, in regards to her insulin administration, with regards to her medication compliance. Okay, so a district nurse has a specific job. You identify that job, you give them a plan what you want them to do. Make sure you remember that this is not a nurse attached to a hospital. This is a nurse who's just going to the patient's home for 10 to 15 minutes to do a particular job. So you only tell them about that job, what they're supposed to do, and the pertinent history relevant to that job. They don't need to know everything about that patient. They only need to know about what's important for them. Remember, this person might already know your patient. So similar to a GP, you can write. So for example, you have a patient who came to the hospital and you increase their insulin. Now, similar to a GP, you let the district nurse know who's already going to the patient's house to give them insulin as you may already know, Mr. Jones has been suffering from diabetes for the past 5 years. During the course of hospital admission, Mr. Jones' insulin has been increased from 10 units to 15 units before breakfast. Okay, so inform them about medication changes and inform them about treatment changes if that's something that you've done. This is especially important for nurses. Okay, specialist doctors. Now this can be very, very tricky. You get a variety of professionals that you write a referral letter to on your OET writing. So this might be a psychiatrist or a psychologist. It might be a gynecologist. It might be a surgeon. It might be a cardiologist. It might be an endocrinologist. Okay, so you give the endocrinologist history about endocrine problems that the patient has. You give the cardiologist the history of cardiology problems that the patient has. You give the psychiatrist a history of the psychiatry problems that the patient has. That can be a little bit tricky, especially with psychiatrists. For psychiatrists, you need to mention things or incidents where you found the patient's mood to be affected. You need to include things like stress. You need to include occupational history, a stressful job, smoking, alcohol. That might be more important to a psychiatrist. Okay, again, smoking and alcohol might be important to a heart specialist. It might be important to, especially if it's heavy smoking, it might be important to a cardiologist as well. It might be important to a gynecologist as well. So smoking and alcohol you can perhaps include in everyone, especially if it's heavy. If guys, please remember, if it's occasional alcohol use, it's not pertinent history. Okay, if it's heavy alcohol use, then it's important history. But if it's for a person who drinks a little bit of alcohol regularly, that's not important history. Lots of people do that, especially people who come from Eastern countries. Regular alcohol use would not, regular moderate alcohol use isn't important history when you're writing to a specialist. Okay, so lots of marks for conciseness and clarity when you're writing letters to a specialist doctor. So make sure you include only profession specific information. Again, I reiterate the point, you only give provisional diagnosis to a specialist. You do not tell if you are a GP or if you are a person working in the emergency department, you do not tell a neurologist that the patient has a space occupying lesion. You do not tell the neurologist that the patient has a subarachnoid hemorrhage, because the neurologist knows better than you. So don't insult them. Be respectful of the fact that they're specialists and give them a provisional diagnosis only. How do you write that? Is you write, we believe that Mr. Johnson might be suffering from, or if you have a problem with using suffering, or you may write might be afflicted from. So that's a new word that we learned today. Afflicted from is a new word that you can use if you oppose the use of suffering, because sometimes OET does have problems with using suffering, especially for non-life threatening conditions. Afflicted is a good word that you can use at this point. So we believe that Mr. Johnson might be afflicted from migraine. Okay, full stop. Excellent sentence after that. However, comma, your specialist opinion and management would be highly appreciated. So see how we made the specialist feel special. We told them that yes, we have a provisional diagnosis, but obviously they have the last word, and that's why you're making this referral. So again, guys, very careful. Read your task, know who you're writing to, select your content, and it would be provisional diagnosis only. Loads and loads of time, doctors, they have a wrong provisional diagnosis, and then they insist and that's the right one on their OET writing. If you do that in your future, working as doctors in the NHS, you're going to embarrass yourself and you're going to get lots of letters of complaints. So provisional diagnosis only. Now, specialist nurse, lots of doctors and nurses, they struggle with the concept of specialist doctors and specialist nurses. Manpreet has asked, what is specialist? Specialist means a person that specializes in a particular field, okay? Like back home, you've got orthopedic surgeons, you've got general surgeons, you've got ophthalmologist, you've got ENT. Similar to that, in Western countries, you have nurses who specialize in different things, okay? So once they finish their nursing degree, then they can do a specialization on top of it. It's something that doesn't happen back home. And that was also a concept which was new to me when I came to work in the UK. So specialist nurses can be, there are lots of specializations they can do. They can either be specialists in diabetes. Tissue viability nurses are very common. Cardiac rehab nurse and Macmillan nurses, they're two new concepts. I'll try and explain that. But just for specialist nurses, especially for doctors who are writing letters to specialist nurses, because these nurses are trained in their specific disease or their specific field, they often know more than doctors, okay? Please and please, I keep repeating this again and again, do not sound condescending to these nurses, okay? They should be treated like specialist doctors. Only provisional diagnosis. Hema is asked for GP, also there are specialists. Hema, GP is not a specialist, GP is a general practitioner who takes care of the patient throughout. They are not a specialist. A specialist is a person who specializes in a certain field. A GP will be taking care of everything. They will be taking care of diabetes, they'll be taking care of epilepsy medications, but to a certain point. After that, the disease will be managed by a certain person. Okay, GP, you can try and compare GP to primary care, a concept that we have back home. Primary care, so that's your primary physician who's going to take care of you. But after that, you'll have your secondary physicians or you have your secondary care. Dr. Khan has said, like back home, just pass MBBS. Dr. Khan, that's wrong. And GP is actually a person who, after doing their medical degree, has done GP practice. They've done a course in GP practice, which is for about 3 years, and they work in primary care, but they're able to manage loads and loads of condition. But after a certain point, they need to refer this patient on. They also manage patient medical records and they manage prescriptions. Okay, so it's slightly it is above just past MBBS. Okay. All right. But again, they're not counted as specialists, they're counted as general practitioners. Okay. So we're talking about specialist nurses now. Two new nurses that I'll tell you about are the cardiac rehab nurse and the Macmillan nurse. So cardiac rehab nurse is, they're also sometimes called a clinical nurse specialist who specialize in cardiology. So they're basically people, if you've got the cardiac nurse is going to be someone who can give limited cardiac treatment. So they can give medications, they can give basic anginal medications, they can do basic management of heart attacks. Obviously they can't do angiograms, they can't do invasive cardiac procedures, but they're able to interpret ECGs, they're able to manage manage mild heart conditions with medications. So those are your cardiac nurses. Then you have your cardiac rehab nurse. So that's basically once someone has had a heart attack, they're going to be they undergo a period of rehab where they undergo gentle exercise to sort of help recovery after a heart attack. So that's someone called a cardiac rehab nurse. So if you're referring a patient to a cardiac rehab nurse, you're going to mention pertinent cardiac history. You're going to mention the goals for exercise, and you're also going to mention things like lifestyle factors contributing to cardiac disease. So make sure you understand the concept of cardiac rehab nurse. So Muhammad Irfan has asked, just for the sake of this, he's asked if after MBBS completed MRC GP working in primary care, doctors still called a GP. So that's actually, if you do MRC GP, it's called Member of Royal College of General Physicians. You qualify as a GP. And please don't be condescending towards GP. GPs actually sometimes earn more than specialist doctors. So their role is not what people back home consider to be. They've got a very, very wide array of jobs to do. They are actually doctors who know the patient so well that from birth to death, they are the ones who take care of a patient. Specialists only come in at certain points at life, but the GP takes care of this patient throughout. So we should treat GPs extremely respectfully. And in the UK, it's a very, very rewarding position to have. It's very rewarding in terms of knowing your patients, knowing your face, and they treating you with lots and lots of respect. And it's very economically feasible as well. So guys, please do not be condescending towards GPs. Okay. Going back to specialist nurses, a very good method of concluding letters to them is Mr. Jones would benefit from your specialist care and follow-up in terms of cardiac rehab. So that's how you can conclude a letter to a cardiac rehab nurse. One nurse I left was Macmillan nurse. So when someone gets cancer, they've obviously got loads and loads of needs. Some needs that they have are they might have wounds which need to be dressed. So if you've got a skin cancer, you might have a wound which might get infected. So the Macmillan nurse might help with that. People with cancer suffer from lots and lots of pain. So they've got lots of pain medications with them. And with pain medications, they get side effects from it. So the Macmillan nurse is going to take care of that. Obviously, when you have cancer, it's a devastating diagnosis to have. So the Macmillan nurse helps with psychological support. And if you've got cancer, which affects your limbs, you might not be able to walk, you might not be able to cook food for you. The Macmillan nurse is then going to help with arrange social care for you. So a Macmillan nurse is involved in the holistic care of cancer patients. So psychology, pain control, social care. Macmillan nurses also help out the cancer specialist or the oncologist in diagnosis. So they're very, very good. So when you write a letter to a Macmillan nurse, all the history about this patient's cancer plus social history, whether they are and pain history are what becomes important. So we've discussed 4 different types of nurses today. The diabetes nurse, so they need to know about diabetes medications, insulin, timing of blood sugar testing. Cardiac rehab is going to have all the cardiac history, social history, lifestyle factors, and exercise. Macmillan nurse is all about cancer and the social aspects of cancer, the pain, the side effects of cancer. The tissue viability nurse is going to be someone who's involved with chronic wounds. So if the chronic wound is related to diabetes or any other skin conditions, they need to know about it. They need to know all the things about examination of the wound if you did some, and the management that you did for the wound. Okay. Diksha has asked some questions about after clearing plaque tube. Diksha will try and cover that at the end. We'll try and be focused on OET writing right now, okay? So everyone, if you've understood the difference between the different types of specialist nurses, please just type in yes. Please make sure that you understand what exactly is to be included when you're writing letters to all of these nurses. Especially nurses, please make sure that you understand this because you're going to get loads and loads of letters that you write to them. Excellent. If anyone has any doubts about the different types of nurses, you can ask me now. Otherwise, we'll move on. Okay. So Nishta has asked about tissue viability nurse. Okay, so tissue viability nurse, as the name suggests, they deal with keeping the tissues viable. So any wounds which the patient has, there can be lots of wounds that we're talking about here. They might be a diabetic foot, they might be a cancer which might get infected, they might be a chronic non-healing ulcer, it might be osteomyelitis. All of these where you have wounds, where you hear the word wound, then you should hear the word tissue viability, okay? So these nurses, they specialize in managing these wounds. So they're going to be involved with monitoring these wounds in the community. The district nurse can sometimes be a tissue viability nurse who will just go from home to home and look at people with diabetic foot. They'll monitor whether the wound is getting infected, whether the wound needs further dressing, whether the wound is getting larger and then they need the patient to go back to a hospital. They might even be able to prescribe certain antibiotics, okay? So wound management in the community and in the hospital, so a nurse who specializes just in that is called a tissue viability nurse. So Nishta, if you've understood that, please type in yes, and then we'll move on. All right. Moving on. Mishta, if you've understood that, please type in yes and we'll move on. Excellent. Now we're going to move on to the next category, the social worker. Okay, so a social worker is someone when a patient has a lot of social care needs. Okay, for example, if a person has quite a lot of stress in their life, or they've got lots of psychiatric conditions which they need a little bit of help with, This is a person who's not medically trained. So we need to understand that they might have some idea about psychiatric problems. They might have some ideas about medical needs, but they're still, you shouldn't assume them to have medical knowledge because they don't have a medical degree. Okay. The main thing that they focus on are the social aspects of a patient. Okay, so that would be your if the patient is a recent divorcee, whether they've got a stressful job, whether they are unemployed and they've got no money to take care of themselves, whether they are homeless, whether they need carers thrice a day. All of the things about the social status would be the main focus of a social worker. Okay, so guys, just remember that consider the social worker to be a layman. So if you've got loads and loads of short forms, for example, a DM for diabetes mellitus, please don't do that because medical terms might not, they may not be able to understand them. Okay. So a good way of writing a letter to a social worker is that you can write that we believe due to his or her ongoing distressing social needs, Mr. John would need appropriate social care in the community or in the hospital. Your help with regards to the social care, you can change the to the care to the social care of this pleasant gentleman / lady would be appreciated. Malik has asked, does social worker need to be told in medical terms? Malik, you need to understand that the social worker is not a doctor or a nurse. This is someone who's just going to help out with the social needs of a patient. So they don't need to know about lab reports the patient had or a remote visit that the patient had with an upper respiratory tract infection. They don't need details of antibiotics or names of antibiotics because they won't be managing that. Okay. So they only need to focus on the social background and the care needs for a patient because that's their job. All right, moving on. A nursing home. Okay. Now, guys, we need to understand the difference between a care home or a residential home and a nursing home. Okay. So a nursing home is like a mini hospital. Okay. So in a nursing home, they're able to give certain things which might be IV antibiotics, sometimes even oxygen, sometimes they're able to give injections. So when a geriatric patient comes to us in the hospital and we're discharging them, if we feel that they've got a lot of medical needs, for example, they've got uncontrolled diabetes, which is going to need wound dressing and regular insulin, or they need regular medications to be given to them, then we refer them to a nursing home, or we transfer them to a nursing home. So a nursing home has nurses in it. Okay, and they are the people who give medications to a patient. So the patient won't be taking medications themselves. They would have a nurse coming and giving them medications. Okay, so when you're writing a letter of transfer to a nursing home, you need to mention the transfer plan for this patient. You need to mention their ongoing healthcare needs. For example, Mr. Jones has been diagnosed with Parkinson's disease and therefore needs the following medications regularly. So therefore he needs levodopa regularly. He would also need regular assistance with activities of daily living. Okay, so a nursing home, you need to tell them about what the medications the patient needs, whether they need assistance with the activities of daily living, whether they need anything else, like they would need regular monitoring of their blood sugar, they would need regular monitoring of their diabetic foot. Okay, so a nursing home is like writing a letter to a group of nurses. You speak to them in terms of their healthcare needs. Now that is different from a residential home, which is just like a house that the patient goes to, and they're only helped with limited things. They won't give you medications, they won't have nurses in them. Okay, so if you've just understood the difference between a nursing home and a residential home, please type in yes, and then we'll move on. Okay, so I'm just going to explain that again, because I think Maria hasn't understood and Saida hasn't understood it, and Sonia needs to know as well. So a nursing home has got medically trained professionals in it. Okay, a residential home is similar to a hotel. Okay, so you can stay in a hotel, you can get food cooked for you, you can go on evening walks, someone will come and take you on an evening walk, you'll have a companion, you'll have people of the same age who might they might plan out entertainment activities. This is very different from a nursing home, which will have nurses in it who are going to come and give you medications, they're going to give you injections, they're going to measure your blood sugar. If you've got a wound, they would dress it. They might give you antibiotics if you've got some prescribed by your regular doctor. They might even give you oxygen. If you've got cancer, they might be able to give you morphine. Okay, so because it's full of medical professionals, the level of care is similar to a mini hospital, while a residential home cannot do any of that. And that's why in a letter to a nursing home, you mention healthcare needs in your concluding sentence. Okay, so Maria, Sonia, if you've understood that, please type in yes, and then we'll move on. Excellent. Okay, just because someone asked, I'll just mention briefly what an occupational therapist is and a physiotherapist is. So occupational therapist are people who help with you managing at home in terms of your activities of daily living. So cooking, cleaning, shopping. Okay, the occupational therapist is going to come and assess you whether you're able to do that. Okay, if you've got a person with dementia, the occupational therapist is going to come and see them and see whether they'll be able to feed themselves, whether they'll be able to wash themselves, whether they'll be able to do shopping for themselves. If the occupational therapist feels that this patient with dementia cannot do it, then they have the power to arrange carers for this patient. So carers are basically people who are not medically trained but can go into the house and help cook for the patient, or they might help and take the patient out. If they've got any medications, they'll be put into boxes and the carers can just ask them, okay, take your medication, take this water with it. Okay, Manpreet, they are not nurses or doctors. They are people what we call physiotherapists in India. Okay, but they're just divided into physio team and occupational team here. Okay, now the physio team are people who help with your walking. Okay, so they're going to help you if you need a walker or a frame. They might even help you if you've got lots of dementia, if you've got problems moving around, they'll help arrange getting you transferred from your bed to your chair onto a commode. Okay, so mobility, moving around, is done by a physiotherapist. Okay, so they are very different from nurses and doctors because they do not give any medications. Okay, so if you've understood that concept, we're going to end the session now. It's been longer than what I thought it would be. I thought I'll finish it in about 40 minutes, but like always, I spoke too much and I bored you guys too much. All right, so those were the healthcare roles and the types of letters that you get on your OET writing. If you need any help with OET writing and OET speaking, please go to our website and we can help you out with checking your letters and checking your speaking. The speaking is live checking. Both of them are done by a doctor and a nurse, and it starts at about 6.99 pounds per check. So please guys do check out our website. We also have group discounts in case anyone needs them. We offer a 25 to 30% discount on your coming OET exam. So please contact us. Next session tomorrow, very useful session by Mr. Manoj. He is going to be covering connectors on the OET writing. Just make sure that you join in that lecture. It's going to be at the same time as the session today. Dr. Khan has asked about the therapist duties, why we need to know them. Is Dr. Khan, you should know them because you might be asked to write letters to the GP. Depending if you're writing the medicine exam, you might have to write letters to the GP talking about occupational assessment for a patient or the physiotherapy assessment for a patient, and that's why you need to understand their roles. So make sure that you understand them, and if you come and work in the NHS, which I'll be very happy to welcome all of you to come and help us out in the NHS. That's going to help you out a lot in your future careers. So again, thank you so much for joining in. We'll upload this on YouTube as well. In case you haven't made any notes, you can make notes, and just keep practicing, guys. I know it's a very difficult time right now, but we'll keep on going through these sessions, and we'll keep on practicing. Occupational therapist Hema. So an occupational therapist is going to assess whether a person can manage at home, whether they'll be able to do cooking, activities of daily life. What do you do in your daily life to help with your care? Cooking, cleaning the house, washing yourself, shopping for groceries, all of them. The occupational therapist, before getting a geriatric patient discharged, they're going to be seen by an occupational therapist, and they're going to assess whether they'll be able to take care of themselves at home. Dr. Khan has asked, is the right time to book the test? Dr. Khan, I would advise booking your exams in July or June or July. Teacher Academy is offering group discount for July and June and July onwards. You can book it, and in case things do go wrong very badly, then the deferral is free. Aruna, this week we're going to be having a session tomorrow, which will be Mr. Manoj. He's giving a very useful lecture on connectors on OET writing and how to increase your OET writing score in terms of grammar. So please join the lecture tomorrow, and keep making notes, guys. Very important. Keep making notes and take all of this information home, and please use this on your OET writing. And I'm sure each and every one of you will be able to pass whenever your next exam is. All right, so we're going to wrap up the session now. If you have any questions regarding the writing check, speaking check, or the group discount, please contact Dr. Prashant. His phone number, I'll put it on the screen. Any questions, please ask him about the writing and speaking check as well as group discount. But thanks again for joining us, and thanks for being a very good audience. Good luck, guys.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.